Hey guys, 48,000. So 48,000 hours is the number of hours that if I had a desk job, would probably sit between now and 55 years old. So as you can imagine, that's a lot of time sitting at a desk, and if you are a millennial or around my age, then you have a lot more sitting to go in your career, and it's probably something that we want to address and take care of, because as we're going to talk about today, sitting leads to a whole host of problems. Specifically, we're going to be talking about our hip flexor and our low back. That's what we're covering right now in our Instagram series, dealing all about hip flexors, low back pain, why it's important, and what you can do about it. So I'm Dr. Alex Ritza, downtown Toronto neurostructural chiropractor, and this is Lunch and Learn TV, and today we're going to give you some really valuable content, guys, especially if you are an office worker and you are living the desk life. So number one, we're going to cover what sitting does to the hip flexor and to the low back. Number two, we're going to talk about why it's important. And number three, we're going to talk about what you can do about it. And we've got 4 strategies for you. So let's get right into it. So, unless you are lucky enough to have a standing desk, most of us are going to spend our day at our computers sitting. So when we are sitting, we're going to, of course, have our knees and our hips at around 90 degrees. So anytime you spend the whole day doing one thing, you're going to get a repetitive strain injury or increase the likelihood of that. Now, we're going to talk about our hip flexor, our iliopsoas muscles. So our hip flexor muscles, we talk about our tight hips. Our hip flexor muscle, it runs from the lumbar spine vertebra, and a very interesting muscle, very cool, because it runs from the lumbar spine vertebra, goes underneath the intestines, and then comes out to insert on the hip here. So you can see it inserts on the front of the hip. It comes all the way from the low back. And so it can do one of 2 major movements. It can either shorten to bring the knee up, or if you keep the hip completely still, it's going to compress the spine and bring it forward into that, what we call an anterior pelvic tilt, or it's going to flex your low back, bend it forward. So either bring the hip up or flex that low back forward and the spine, as well as add a compression force. And so this latter issue, where it compresses the spine and flexes it, is the problem with doing so much sitting. So if we're going to spend 48,000 hours sitting between 30 and 55 years old, that's going to cause a lot of shortening of the hip flexor. So the body's always remodeling itself. It's always becoming new. And that's why, it can adapt to injury. It can heal. If you go to the gym, you can get bigger and stronger. But if you sit for that many hours, your hip flexor, which was, say, this long, might fold in half. Not actually half, but it might get a lot shorter. And if it gets a lot shorter, it's either going to cause the hip to come up, which, of course, we're walking, that's not going to happen, but it's going to pull us forward like so. And so we know that the hip flexor can shorten and become much tighter with a lot of chronic sitting. And so with our short, tight hip flexor, from sitting, it's going to pull us down into more flexion in the low back. It's going to add more compression to the spine, and it can actually cause some structural shifts in the spine. So in our practice, we try to have a very long-term look at people's health and their wellness. And we think about the hip flexor, we're talking about remodeling of it so that it actually maybe changes its shape or changes how long it is, and it might cause some structural shifts. So when we do an assessment of someone, we're looking to see are there any actual structural shifts in the spine that could be putting stress on the spine and nervous system. So the analogy that we often use is it the CN Tower, your spine? Is it nice and straight and well aligned, or are you more leaning Tower of Pisa? And if you have a short hip flexor, well, you're going to be more leaning Tower of Pisa, or at least your pelvis is going to tilt forward. It's going to be more leaning Tower of Pisa. So is this a problem if you act like this for a day? No, but if this is your life and this is the structural shift that you have in your spine, then that's going to be a significant problem. It's going to put stress on your nervous system and might increase the likelihood that you're going to get low back pain and other problems of that sort. So I think this is one of the most important things that should be a priority of anybody who sits all day. This is something that is going to be an investment to help make sure that this muscle, your spine, and your nervous system functions properly so that you don't end up in our office in terrible acute pain. So a couple things we want to talk about. We're talking about 4 strategies here, guys. These strategies are going to be really, really good to make sure that you take care of your hip flexor, your low back, and your nervous system. Number 1, if you read our book, The Sitting Antidote, we talk about moving every 10 to 15 minutes. So some people go, oh my God, what, I have to move every 10 minutes and take a break? No, you have to move every 10, 15 minutes, but you don't necessarily have to take a break from your work. All that you have to do is you have to take a simple break so that if I'm working away at my desk and then my 10 minutes is up, I've set my alarm, I can just stand up, do a little stretch, do some typing, and then sit back down. So that 3 seconds of movement, how much productivity is it going to cost me in the long run? Probably about 0. Versus, if you're hung up for a week or 2 because your back is terrible or because it hurts and you're losing concentration, that net gain on productivity, I think I'm going to win that argument. It's just a reminder. I highly recommend set an alarm, put something on the computer, put something on your iPhone. It might be annoying in the short term, but we're playing the long game here. Number 2, in terms of managing the hip flexor, the low back and the spine with all that sitting, the best thing that you can do is get yourself a sit-stand desk. So a sit-stand desk is fantastic because it's going to reduce the amount of repetitive strain because you're going to be able to do multiple things and stand in multiple positions. Neither sitting nor standing is probably better than the other for the low back, but when you can vary up the movement, it's going to allow you to take strain off the low back. So a lot of people ask us, they get a standing desk, they stand for 8 hours a day, and they get a new problem. Maybe it's tightness in the hamstrings or tightness in the low back. Their neck feels better, but there's still some sort of repetitive strain, and that's just the fact that you've done something for 7 or 8 hours straight that day without a break or not taking enough breaks. So you're still going to have strain, but the sit-stand desk allows you to load different muscles, different joints, different tissues, and when you can load different muscles, joints, and tissues, take the strain off, your back and then your lengthened hip flexor is going to be much better. Number three is making sure that the hip flexor does not get locked in that flexed position with flexion through the hip, and we want to make sure that we're able to bring the hip backwards into extension. So when we bring the hip up in flexion, we get about 135 degrees of motion. Hip extension is a little bit less. It can only go back about 20 or 30 degrees, and then it runs out of room. So to make sure that the hip is going to extension, this is where I highly recommend you check out our Instagram hip flexor week that's coming up. But just to see what it feels like, standing nice and tall, ear, shoulder, hip, knee stacked up. Hip extension is simply executed by keeping that tight, tightening up my glute, and you'll see that when I tighten up the glute and bring the hip back into extension, no movement from the low back, just here in the hip joint, we only get about 25-30 degrees of motion. So you want to maintain that hip flexion as much as you can, and that's going to come from daily stretching, going through some of the mobility drills either in our MOOC curriculum or our hip flexor Instagram week that we've got going on right now. So those are going to be really, really excellent tools. So to highlight again, point number 3, you want to make sure that that hip goes nicely back into extension, which is the best way to stretch the hip flexor. And then number 4 is something what we call reciprocal inhibition. So what does that mean in English? That means that when one muscle turns on, the one that does the opposite motion has to turn off. And so our hip flexor brings the hip up into flexion. Our glute muscles, they bring the hip back into extension. So when the glute is turned on, when it is active, the hip flexor by definition is going to lessen and loosen up and be more easily stretched and naturally going to sit in a better position. So if you had a perfectly balanced hip flexor and glute, you're going to be nicely stacked up and structurally very aligned. Whereas if the hip flexor is dominant, it's going to bring us into forward pelvic tilt and lumbar flexion. And if the glute is more dominant, you're going to get a little bit more extension through the hip. And usually just the way that our world exists with so much sitting, most people are hip flexor dominant, bringing them forward into anterior pelvic tilt, lots of compression in on that spine. So we want to really target the glutes. And when we target the glutes and get them stronger, it's going to make the hip flexor turn off and go a bit quieter, easier to stretch, less compression on the low back, less tightness in the hips, which I think anybody that has a desk job is going to love and really, really appreciate. So we highlighted 4 main strategies here today. And they again are making sure that you're strengthening the glutes. We'll go in reverse order. Strengthen the glutes. Make sure the hip moves back into extension. standing as much as possible at work instead of sitting, and then of course taking breaks every 10 to 15 minutes to stay mobile, take repetitive strain off the body. If you want to get right into number 4, strengthening the glutes, we've got lots of content available online. You can go ahead and download our Strong Knee series. That's in the link in the bio. Those exercises for the knees happen to also target the glutes, and they're going to be great for managing the hip flexor as well. And then to learn to stretch it, follow along on our Instagram. It's dr.alexritza, where we're going to give lots of stretches and some tips that you can use over the next couple days, well, over the next couple decades, to keep that hip flexor loose. Next week, we're going to go through our hip flexor and psoas, specifically some stretching work, some activation of the glutes. We cover the basics here today on Lunch and Learn TV. I hope you guys all have an amazing Monday. Today's Monday. If anybody knows that they are structurally shifted, or they know a friend that's structurally shifted and think that they have a hip flexor problem causing low back pain, or just have low back pain that needs to be dealt with, please send us a direct message, send us an email. Let us take care of them. Let us at least do a comprehensive review and see if they have a core problem with their spine and nervous system. Otherwise, guys, I'm signing off. You have a wonderful day, and we'll see you guys soon. Bye.